Hi there, my name is Gerard Greene. I'm a pelvic health physiotherapist in the West Midlands in the UK, and it gives me great pleasure to welcome one of my closest friends and one of my pelvic health colleagues and pelvic pain colleagues, Sarah Marsh from Richmond in London. So Sarah, really nice to see you on this bright April morning. And how this kind of came about was in my day-to-day role, I see lots of male pelvic pain patients and lots of female pelvic pain patients. And also in my university role in Coventry University, I'm kind of involved in research into pelvic pain. And I was quite interested in how is COVID-19, so the enormity of COVID-19, how is that affecting men and women with pelvic pain? So I just did some posts on some of the patient groups and was quite staggered really and overwhelmed that I got about 50 people contacting me. And in time we're going to write that up, what they felt the implications of COVID-19 was. But a lot of people said, well, is there anything that we could do? Could we produce something that might help to even a small degree during this really challenging time? And Sarah does a couple of really unique things. So Sarah is a specialist in male and female pelvic health, particularly pelvic pain. Sarah is also a yoga instructor, and she also trains a lot of people in yoga. So she contributes to the courses that train yoga instructors. She's also teaches yoga to physiotherapists, so how they can use yoga within their practice, particularly in pelvic health. But she's also, for many years, she's been involved in the delivery of kind of courses and strategies on management of stress, anxiety, really how to kind of improves people's strategies for their mental health. And then so I asked Sarah, would she do a short session that maybe people could do at home? And Sarah, although she's very busy, she's off to work in the Nightingale London, which we're all really proud of. So Sarah said yes. So I'll hand over to you, Sarah, and many thanks for taking the time, because I know you're really busy at the minute between transitioning from your pelvic health role to working in the Nightingale.
Thank you, Gerard. So yes, I think I'll be putting some of my own strategies into practice with going into Nightingale, which I'm delighted about, but like everybody, feeling a little bit nervous. So I talk a lot about stress and resilience, and for me, whether I'm talking corporately, one-to-one with my patients, or I'm talking yoga, it really does all come back to the breath. But sometimes we need to find a connection or a hook for our patients so that they are interested in what we're trying to say. Certainly with some of my pelvic pain patients, male and female, if I get to yoga, they're like, no, we can't deal with that. So what I wanted to do is talk a little bit about what I found. I've had a couple of patients in the last 2 or 3 weeks, and one with general anxiety disorder on top of a developing prolapse. So of course, can't see this lovely lady, but had a long conversation about where the breath was, whether she was lifting or releasing, whether she was moving anything at all. And of course, that's just adding to her anxiety at this time when she's stuck at home, small environment. So just want to start a little bit really about, so I start with the breath. And why do I do that? Well, you guys will all know that our pelvic floor muscles, unfortunately, do not move in quite the same way. I mean, they lift and release, but it doesn't feel the same. It's not as easy to access. A little bit too bit like that. Too much sunshine this morning. They don't move in terms of contracting and releasing, contracting and releasing. We're drawing up. So patients quite often find that quite hard to access. And whilst we can isolate, we also know that they are linked with the whole of the diaphragm, the lower transverse abdominals, and this whole core area. And I'm always still amazed by the amount of people, predominantly women, but men too, who, when you say take a breath in, they're like, and they're sucking in. So
yeah, exactly.
That's really, so and you think, okay, so where are we going with that? So this is my lovely, the animals, the kids love it, but this is sometimes what I use to try and demonstrate. So if we're thinking this is the lungs at the top, we take a breath in, we want to breathe all the way down and then exhale all the way up. But if we're holding, we're just getting this amount of movement here. So I try and show them visually about this is what we want to be doing as opposed to just working here. to explain that we want a full range. Because if you're having any issues like pain and we get to hold, that's also not going to be helpful. So I also talk to stress, anxiety, and for me, the polyvagal theory, and Dr. Stephen Porges, who talks about fight or flight, which nearly everybody we see is familiar with. And right now is a time of increased anxiety. So there will be on occasion more adrenaline, more cortisol, none of which helps the breath. And we need to allow that to come back down. The option of freeze, which is much more internal when we go into a holding mechanism. And anybody who is in pain, chronic pain, worried about incontinence, anything like that, asking them to release when they're stressed, and either their fight or flight is up here or they're holding, there's just very often not much movement. So before I get them into doing their pelvic floor exercises, I want them to release and relax. I think these people will not have ages, don't you, Gerard? We need to find not a trick, but we need to give them strategies that aren't necessarily 20-25 minutes long at this point in time.
And I think at the minute it's particularly relevant because obviously lots more anxiety and worry around, but also people's days are quite fragmented now. So some people are working from home, so they're balancing maybe doing Zoom or Skype appointments with looking after the kids, or helping with neighbours, or all of those other things that they have to do in this time.
Exactly. So I think we have to find it in sort of bite sizes. Well, often people think, well, you can't necessarily see this pain if it's pelvic pain, and there's so much else to worry about, then they actually stop their self-care. So we know how important it is to maintain self-care, consistency and practice, so that we can actually access it when we need it. And now is exactly the time that we don't want them to stop. So what I thought I'd start with, I'm going to do a couple of things. So I'm sitting on a little cushion because I prefer to sit on something when I'm sitting cross-legged. And whatever comfortable position we can get someone to be in, I will do a lying down position in a moment, but seated, it might be supported against the back wall, doesn't have to be legs crossed, it can be legs straight. So whatever somebody finds, help them to find, for them, a comfortable seated position. I then ask people just to connect with your breath. So I'm going to talk it through now as if I was talking to a patient. I think that sometimes is more helpful. So to connect with the breath, just listen to what your breath is doing right now. Don't try and change it. It's all just to bring awareness. And it helps us bring a little bit of awareness internally a bit. So we just start to focus down. That very act can help us get away from fight, flight, and freeze and start to come into social engagement where we feel safe, we can rest and digest, and things can move. So don't change the breath, but do bring your attention to your inhale and your exhale. I ask people just to sit with it 4 or 5 rounds. They're very welcome to close their eyes, or possibly if you're not happy with closing, then I'd like to find a gaze point. So something where you're looking probably towards the end of the nose, just around the cheeks, just to focus a little bit. It allows you to lose some of that external noise. Then bringing hands to the lower belly. This is when we inhale, belly gently rises. As we exhale, belly gently falls. And at this point, I'm not even talking about pelvic floor yet. I just want them to engage the breath. So inhaling, belly rises, gently pushing against the hands. Exhaling, belly falls. Inhaling, gently rising, relaxing the shoulders, just relaxing the body. Exhaling, falling. Inhaling and exhaling. Then, for some people, that's not so accessible. The other part I really like is around the ribs and the whole bucket handle. The fact that when we inhale, we're taking air in. So my ribs have to expand to allow air into my lungs. And this is how I sometimes get around the sucking in when we inhale. So bringing hands to the side of the body. So when you inhale, feel that gentle pressure against the ribs pushing against the hands. And then as you exhale, it pulls away. And for some people, postnatally, and if they're not yet connected with this area, this is a much nicer place to be. So again, just inhaling, exhaling 4 or 5 times. So starting to bring that connection. Then saying, how does your breath feel at the moment? Is your inhale quite equal to your exhale? Are we getting that nice flowing movement? Then I can start to talk to the fact that when we inhale, we're relaxing everything down. When we exhale, there's a natural draw up. So you inhale, and the diaphragm is moving down, so that's pushing down the pelvic floor just a little bit. And when you exhale, the reverse is happening. So if we can link with the breath, first of all, what we're doing is using our anatomy. So to talk about getting more bang for your buck, you know, so we're getting it anyway. So not even worrying about the pelvic floor yet, but just connecting back in to stop this holding mechanism. I've got that settled a bit, then I'll ask them to close their eyes and do a couple of moments. I often talk about a 3-minute rest or a 3-minute breathing exercise. There isn't a magic time. I just think if you're talking a patient into it and out of it, it's quite a nice short time, and it seems to be long enough to get away from fight and flight, move away a little bit from freeze, and come back to social engagement. So just closing your eyes or finding that gaze mood. Again, breathing first of all. I might try with people just to think about taking an inhale, pause, exhale, inhaling, pausing at the top of the inhale, exhaling, inhaling, pause, and exhale, inhaling, pause, exhale one more time, inhaling, pause, exhale. Again, I'm not asking people to hold the breath. That's fundamentally not what I want this group of people to be doing. But sometimes that pause gets that little bit more air into the lungs, so they have a slightly longer exhale. We all know that at that point the pelvic floor is moving up a little bit. So I've connected in that way, and you can try 2 or 3 of these, and I think it's quite easy for people to try at home. You know, literally 5-10 breaths just to connect in before we start doing anything else. And we've started then to get the breath, the lungs, even the voice diaphragm and the pelvic diaphragm to start to move together again with less of this gripping feeling. So I might just work with that to start with before I then talk them through inhaling and exhaling, lifting the pelvic floor, inhaling, release. But I want to settle them first of all before I do that. So we've got less of that movement. Something else that I do is just turn on the camera. Again, working really nice and easily is lying down, knees bent. Has to be the best posture, I think, in yoga ever. It's the one that everybody absolutely loves. When I say I'm teaching this in yoga, everyone just gives a sigh, but that's it. Let me just check that you can see me. Yes, so lying down, knees bent. And again, you might need to support people. They might need cushion, anything they can have to feel nice and comfortable in this position. Knees bent to start with, and then again, coming back to what we were doing. Neck is nice and long. Just allow the shoulders to open up a little bit on the floor of the mat. My knees are bent. So I suppose in a bridge position, if you were due to come up, start with just bringing the hands to belly. And taking a nice breath in, nice breath out. You can start to deepen that breath. Nice inhale and exhale. Again, not judging it, just acknowledging how that breath is today. Inhaling and exhaling. And if that's feeling fine, can you start to increase the length of the inhale just a little? Inhaling and exhaling. Just knowing that when you inhale, that diaphragm, pelvic floor moves down slightly when you exhale, gently comes back up. Staying released and relaxed in the whole of that area, not squeezing or tightening, just staying with your inhale and the exhale. Again, for those who don't really like their belly to move, for those patients bringing their hands to the outside of the ribcage, again inhaling and exhaling. Just feeling a slight movement, a nice gentle pressure. And releasing. So again, no holding, no tightness, just a nice rhythmical movement. Knowing that when you inhale, pelvic floor is releasing slightly. When you're exhaling, gently coming back in. And if somebody's comfortable here, I quite like to add a little bit of movement in. So I'll get them to either have the hands on the side of the ribs or on the belly, or gently on, but not pushing. It's all about just getting a little bit of releasing, taking a nice breath in. And as you breathe out, gently coming up to a bridge movement, not pushing it, but keeping these nice and parallel legs strong. Inhale here, exhale, come down and pause. Inhaling. Exhale, gently come up. Inhale Exhale, come down and pause before we start again. So now I can add into that the pelvic floor movement if I wish to. So inhaling, exhaling, coming up, gently allowing the pelvic floor to draw up, and it naturally with gravity. So inhaling here, nicely exhaling, coming down. For some patients, I will get them to gently bring their hand just between their legs if they feel they need to really make that connection. So not pushing too much, but inhaling. Exhaling, drawing up and feeling a little bit of that movement away. Inhaling down. Exhaling up. Inhaling down. Exhaling up. Final inhale down. And then just come back to the breath. So in this position, we can play with lots of gentle movements, just keeping that release as you inhale. So nice soft movements if we need to, but staying here can be so helpful for many people. No pressure. Legs can be straight. I personally feel that's a little bit too much pressure on the lower back. Sometimes when exhaling, I'll get them to breathe out and actually audibly exhale to really know that we're getting that little bit of a lift. So I might inhale. Exhale with a inhaling. Exhaling, pause. Just coming back up to a seated position again for a moment. So lots of little things just to get them to find that way of settling and releasing everything so that we can then get back to starting to manage their pain. And it might be, of course, that you need to release the pelvic floor. It might be that their pelvic floor is hypertoned in certain places, hypotoned, but at the very least, what we don't want them to be doing is coming into this holding pattern. So I use a lot of these techniques, and I perhaps come back to them in between exercises just to help them connect, but knowing that the science is there to tell us that the easiest way to bring in our parasympathetic nervous system, because fight and flight is a sympathetic response, the easiest way to access that is to take some breaths, but take your breath. So we don't want to add the stress to the person to say, breathe in for 4, exhale for 4. Just letting them play with their breath and beginning to place hands on all of those areas that they need to release. And that right now, I think, possibly not just for patients in pelvic pain, just needs to be the starting point to really get people to connect back in and get everything moving before they start doing any other exercises around that.
That's brilliant, Sarah. And I think what is particularly brilliant to see is that, you know, you live in London, and London's an amazing place to live, but, you know, people don't have a lot of space in London. So I think you're doing this in a real home, a real kind of front room with furniture and stuff. So whereas I think when you look online, you know, you see people doing these exercises in a beautiful yoga studio or a pristine, you know, Joe Wicks type front room, whereas it highlights that you can do this in real life.
Absolutely, and we don't have lots of room here. It's a mistake of moving into a flat you were doing up when the workmen can't come in lockdown. However, what I've worked out is that we've had to move things around a little bit, got a bit of space. I have to relocate the dog when I'm doing this, although she's quite happy most of the time. But it really has made me realise actually that I just need to sit and breathe for 2 or 3 minutes. It doesn't need to be a lot longer. And if we can get people to incorporate that into what they're doing, whether it's just sat at their desk and I'd like them to move a bit more, just connecting in, just to sort of take some of that stress and anxiety away and keep things moving, we know that that's going to help their pain, and it's just a strategy that they need to then go back to some of the other exercises that they are doing that are we know helping them too, but doing it from a place of release and movement and flow rather than a place of holding.
And Sarah, I'd just like to say just a really big thank you for taking the time out of your day to do this for us. And I think it's also really important, so it's from both perspectives, to say to people with pelvic pain that although they may not be able to attend some of their face-to-face appointments, whether that's with their pelvic pain specialist, that might be with the urologist, maybe another specialist, that may be with their pelvic health physiotherapist, that there are lots of people, including myself in the West Midlands, yourself in London, doing online appointments. And, you know, we have some great pelvic pain colleagues in different parts of the UK and in Ireland, in Australia, New Zealand, States, Canada. We've got a big network because we're quite a supportive group. But lots of those brilliant people will be providing online support. So, and sometimes that gives that maybe degree of reassurance that help is still there.
I think
and then
you found that it's actually working quite well, really.
Yeah, and also it saves those big car trips to see someone. And we can find you at, where can we find you, Sarah?
Here. I'll be here for it.
Yes, Sarah's not well.
So my website's sarahmarsh.co, with
Brilliant.
no .co.uk, just .co. But thank you so much, Gerard. And if any of this is useful, or if I can help any of the other physios, be really happy to do a session with them. If I can help them at all, absolutely be delighted to.
Yeah, that's brilliant. Sarah, many thanks, and just give me 1 second, and enjoy the rest of the day, and good luck in the Nightingale London. We're all really proud of you.